With the I guess it also just depends on what you're doing with that device during the scope of that study. For example, if you're using it for the pre-assessment and then it goes in an office and sits there and it doesn't get moved a lot, and then it might be okay for, I can't say for sure, but it might be okay to then just use it for post. But if you're also going to do a bunch of other community-based work where it's getting moved a lot and it's being used a lot, that could affect.
Yeah, and it, ours is, we use one per study, but that one device is used one per study across 3 or 4 different studies and settings and all that. And they're on different timelines. It may be a 5-year study, a 2-year study. It may be, a student pilot or something like that. That's only 6 months. And so there never seems to be this opportune moment to send it, lose it for a week or whatever, and get it back when there's no overlap between those studies that are going on. And because we try to gather as many data as possible and as many populations, and we even let people outside of our department use it, like asthma clinics and with some Down syndrome folks and things like that. It's just never not being used for something. So it just trying to figure out that, okay, is it once per year, and just kind of try to not get it in between a pre-post for the participants in each one of those studies. These types of things get a little hairy, I think.
It does get hairy. And I will just plug one more thing for Susan Sisson. I wish she was here today. Karen will have to ask her why she didn't come. But she has been actually developing a training protocol where she is developing a very specific protocol where if someone wants to borrow her device, they have to be trained and certified. And I don't know if she's going to do a every year kind of thing or what, but they're going to have to be trained and certified. And then there's an agreement in place. So you talked about different people borrow it and they take it here and there. What she's trying to do is actually standardize that for herself a little bit more clearly, to know who has it when they have it, if they've been certified, are they using it properly? Just to make sure that, when it goes off with whoever, that they have been at least trained and she knows that they know how it works. Jared McGirt had brought up a couple times where students have used his and they've not been as careful with the cord or something, how the cord needs to go in or how it needs to, things like that. In her stuff, I think that addresses, and maybe that's something we all need to think about or collaborate on, a training protocol type thing, where if it is being moved around and it isn't just your lab that uses it, that there's more consistency in what people are being taught in terms of how to use it.
Jessica, could you talk a little more about, sorry.
Please go ahead, please.
Okay, just about your work in the clinical setting, because I've often thought about how helpful it could be, just motivating change just in the clinic. So I don't know if you use it in a healthcare provider situation or kind of how you're using it.
We're using it in research, but in clinic, obviously I spoke to our asthma clinic here, just started using, which I think is going to be really interesting. There's an exercise program outside our department with individuals with Down syndrome, and I think that can be really interesting as well. I work with it directly with Alzheimer's and ketogenic diet. And then we have a Mediterranean diet low-fat study that uses it. We have a high fiber in pregnancy study that's using it. And then, of course, we take it to health fairs and anything university-based that we can plug. In terms of the motivational factors, so for instance, just anecdotally, what I've heard from Dr. Lauren Tomey, who's doing it with the Down syndrome folks, it's really easy to see that, I can't remember who was speaking to it, but the rainbow, and that can be really fun. And maybe in populations that don't necessarily want to eat a whole lot of vegetables, a lot of our pregnancy studies are in underserved populations that may be in food deserts and this kind of thing. For my Alzheimer's patients, it's really good. There's a lot of caregiver burden that can be a barrier. And so that is just, sure, blood values, la-di-da, that's kind of standard. They're used to hearing that kind of thing. but the Veggie meter, everyone's always really excited about it and say, oh, oh, I moved it up a little bit. Oh, I'm out of the red, I'm in the yellow, that kind of thing. And it just is, I think, motivating for them. And I think it's also dependent on how long the study is. Like for our Alzheimer's group, it's 12 weeks. So there is room to really move it. Whereas, in those shorter studies, there may not be that room for growth. And so I don't know if that answers your question, but I think in terms of interventions, it's something that people are intrigued by. And I think that it being an objective measure of the things that they're working really hard to try and adapt, and something visual that they can see, and trying to get on that right side of the histogram, I think it's just an easy visual for people, and they get excited when they move it, and they get bummed out when they don't, and so they say, oh, I thought I was doing better, but really, I guess I wasn't doing so hot, and so it kind of lights a fire under them, I think, in an easier way than sometimes the lab biomarker jargon that we throw at them.
Thank you. That's helpful.
I would completely agree. I'm a researcher at a Nationwide Children, and we use the older version use skin, but in the community setting. But I'm excited about the clinical properties. I'm a physician, MD, trained med peds provider, so I see both adults and kids, and as you can see applicability across the spectrum and intergenerationally. And even the kids that we use it for in the community setting, parents are excited to get their levels checked, and they weren't part of the original, cohort. So there's a lot of excitement in that, and I would love to test this in a intervention from a clinical standpoint, because a lot of our parents who are taking care of low income families don't want to get their kids' blood drawn, even for like routine blood tests, as in 9 to 11-year-olds supposed to get lipid profile. Later we'll skip on that, and I think people get a little bit turned off with BMI and obesity counseling. So I think there's some I'm really excited about where this research can go, and I'm looking forward to be part of this group and some of the ideas that are being shared here. Thanks for letting me join.
That's great.
This,
This is Brenda again. I would just say that I think an intervention study is just so important to be able to determine if you do increase someone's fruit and vegetable intake by a known amount, like kind of mimicking the paper that Lisa Jones did, to see, what do you see? I mean, we're assuming that you see something, but I'm not sure that we actually know that yet. And Lisa Johns, before she did her study, she actually depleted patients of all fruits and vegetables. She stopped them eating fruits and vegetables and then gave them about 6 to 8 fruits and vegetables. And, she was able to see about a 200% increase, but that was in a very, clinical setting. So I think even doing a repeat study like that would be really informative. But in the real world, what do you see? I think that's so important to find out. So I applaud you all doing that work.
Well, just really quickly to jump in there, I think another great thing about being able to do interventions and multiple interventions with the Veggie meter is then we get to cross analyze. So I just did a recent analysis between our cognitively normal older adults that are baseline, but they're joining a Mediterranean or low fat diet study, and then I've got my Alzheimer's folks over here, and we did a matched pair analysis, and we just, regardless of dietary intake, their Veggie meter scores were significantly different. So just having these different bodies of data to be able to cross-analyze like that, and I think it's using the Veggie meter in kind of a novel way of looking at different disease states and different metabolic states across populations. So I think that's really exciting. And that's Dr. Deborah Sullivan is my mentor, and she is in study session today, but she recommended that I join because I really am excited about this technology. And I think there's just endless opportunity for us to learn about these different metabolic states that I was talking about.
Yeah, I agree with that. We published a paper on looking with the other technology, the Raman, but we actually found that obesity, it was in overweight and obese breast cancer survivors, but obesity was a much stronger predictor of skin carotenoids than fruit and vegetable intake by far. So I agree that looking at it in different disease states would be very interesting.
So I don't want to interrupt very interesting conversation, but we are running out of time. And so I have both my contact and Virginia's contact information up on the last slide. I've dropped the survey link into the chat. Please, I encourage you to complete the survey so that you can first share papers, as Stephanie just asked, because it'd be great for all of us to be able to share papers, but also answer questions about if you'd be willing to present next time and how often you'd like to continue doing these forums. For the recording, we can send it out through the listserv. I'll have Virginia we'll send that next week. I want to leave you with, we're in the slow process of developing a website where we can house a lot of this information. So we'll be able to keep the webinars, repository of papers, eventually maybe way down the line, some sort of data repository, though there's a lot of complicated issues with that. But also we spoke to the editor of CDN, which is where the protocol paper was published, asking, like, as things evolve and change for our recommendations, what should we do with that? And he said, basically directing our users to a website where we can post updates as to the protocol is probably more effective than changing the paper. So that's the goal. We know that things will evolve as we talk as a group and realize recommendations should change. Virginia, did I miss anything?
No, that's excellent. And if you want to be added to the listserv, if you're here and you haven't been yet, please reach out to me and I will get you added as quickly as possible, because we'll be sending things out and periodic updates through that listserv. If you don't want to be added, but you want me to send you the things from the forum, email me as well and we can take care of that.
Yeah, so thank you all.
Yeah, thank you for coming.
And thank you to our speakers, our inaugural speakers. We really appreciate it.
Thank you for hosting. This was really helpful.
Of course.
Fantastic.
Thank you.
Yeah, thank you.